Welcome, everyone, and thank you for taking the time out of your busy day to join us. My name is Aaron Clifford, and I'm the Senior Vice President of Marketing here at Binary Fountain. And we know that there were a lot of webinars you could have attended today and a lot of other activity, but we are really appreciative of you joining us today. I'm with Binary Fountain. In case you're not familiar, we're a single platform for businesses to manage their online reputation, online listings, or better known as customer experience, as well as employer brand, and also providing surveys. As a company that services a number of healthcare clients and organizations, we know that it's been an extremely challenging time for everybody in business and in their personal lives. So again, just so grateful that you're here today. And we're going to try to squeeze in as much helpful information in the 30 minutes as we possibly can. So to help with answer these questions that you all may have and that we ourselves have, we're going to answer our own questions at times. I'm joined by Reed Smith, VP of Digital Services for a healthcare marketing agency, Gerard Phillips, Kate and Hancock. Reed is here in Nashville with me, although we're socially distancing. We're not in the same place, but it's a beautiful day here. Reed, care to introduce yourself more and tell us what you're doing at
Yeah, absolutely.
Gerard? Right.
Yeah. Thanks for having me, and thanks for giving me a chance to come on and spend a few minutes. So I'm with Gerard Phillips, Kate and Hancock. We're a strategic communications firm based here in Nashville with offices also in Chicago. We work with hospitals, healthcare systems, and other provider organizations around the country. That's all we do. That's all we spend our time doing. And typically, it looks like, a lot of what we're doing right now. So we spend time with organizations in the midst of change, challenge, opportunity, things like that. So crisis communications, issue navigation, things like that, even change management are all things that we spend a lot of time thinking about, working on. And just happy to be here and share a little bit of knowledge.
Just in January, we've been tracking so far in 2020 keywords around COVID-19 and coronavirus. So we've been looking at all the platforms that we monitor for our clients, and so far, if you see, we don't have it in January, but in January there were about 1,100 mentions, and we're tracking COVID-19, coronavirus, or including the SARS-CoV, Wuhan, all of the different terms that are related to COVID-19. And we just started getting a trickle in January. So it went from 1,100 to about 2,300 in February to 96,000 mentions, and then to already where we're at about 53 mentions so far in April. And this is just related to the virus or a version or of the virus term, common terms, and the brand itself. So we know there's a lot more, but this is what we're tracking so far. So massive amounts there. Twitter is getting the most. Google shutting down its reviews, or the ability for people to leave reviews. Really, we would probably have seen a lot more there, but it has dropped since they've not been allowing. They're starting to turn that back on. We'll get into that in a little bit. But the number, COVID-19 is the clear leader in the term, and then coronavirus is the next in line. And then we've been tracking things, the medications. We're not getting as many medications mentions as you would think, but I imagine that we'll be seeing the mentions that consumers and patients have around medications will start to grow. So Twitter's leading the charge, and then Facebook. Facebook is the next one. They're in comments, and then visitor posts after that, a number there. Not seeing as many Facebook reviews. So a lot of folks are going to the brand itself and on the brand page, Facebook page, and leaving comments and asking questions there. Instagram posts is not as many. There's there are some, it leads, there's more than Facebook reviews, and then Yelp surveys. And then we're seeing, obviously it makes sense if clinics are not seeing the volume that they have, why we're not seeing as much on Health Grades and Vitals and some of the physician-specific platforms. So that's just a quick overview of what we're seeing from our standpoint in the comments. Next, from a Google and listings perspective, we obviously have seen visits and views of on Google search go down. So this is in the map pack and specific views that we would normally see, given if there weren't COVID-19 and a bunch of clinics and surgery centers being shut down. Those have dropped off a lot. So the total clicks to the Google My Business profiles have gone down. And then even clicks to the websites from the Google My Business page have gone down over the past 4 or 5 weeks. But obviously, clicks for phone calls have gone up in the same period of time, in the 5 to 6% range. And so other things that we've seen and research that we're seeing validates that this is true across all healthcare. So not just using our data, but the number of phone calls increasing, but obviously some of the people clicking for directions and all that's not happening necessarily. Just to give you an update on Google, they have turned back on the review responses after the suspension. So you can now respond to reviews. However, new reviews, they started up again last week, but it looks like it's a slow rollout. So into our platform, we're seeing some retail customers and some restaurants receive reviews, but we're not seeing any healthcare folks start getting reviews right now. But that is probably coming in the next week is our estimation. Nothing official from Google on that, but just our estimation of how we're seeing things so far. Google Q&A remains offline, and so that functionality, we don't have word when that's going to be turned back on. But there are several things that you can now add related to COVID-19 to the Google My Business profile. One of those are special announcements they added to Google Search. So you can add specific website markup, which is highly recommended, or you can submit a custom announcement through the Google Search console. Healthcare organizations can now add URLs for the COVID-19 info link and the telehealth info link attributes within Google My Business. Those are just rolling out this week, so we recommend checking your Google My Business dashboard to see if those are available and updating your profiles with that information. And then Google Posts are still available and recommended. They will last for 14 days, which is more than the standard Google Post, and they're displayed more prominently on the Google My Business profile. So in case you've not looked at and audited and have updated your Google My Business posts, keep up to date with those. Very helpful information and content that your patients and consumers definitely can benefit from. Facebook also has added a few more resources to help businesses. So they're prohibiting exploitative, how do you say that word? I'm struggling with the word exploitative type of tactics and ads, and they're banning ads for medical masks, hand sanitizers, disinfecting wipes. They're banning all of those ads. So they've made a few updates as well. Nothing so far regarding reviews and ratings. And then also they're offering free advertising credits for some organizations to run coronavirus education campaigns. So if your organization is doing that, please take advantage of those offerings. And then Yelp also, they've created a banner alert that's placed on the business page with a message to customers about their businesses. They are being very restrictive. If any consumers blaming organization or business for contracting COVID, they're being very diligent about not posting those reviews. And so that's good news. for businesses, because we don't want that. So there could be a lower amount of reviews, but that's good if it has information that's not helpful. All right. There's a few things, and Reed has been in the thick of it, just from a crisis communication standpoint and his firm. And so I thought it would be helpful, Reed, just to hear from you and what you're seeing and what strategies folks are using and what you're recommending for health organizations to manage through this crisis now and in the future, now that we've been in it a few weeks.
Yeah, absolutely. I think we're at a place now, pretty comfortably at least, where in the initial days, hours, even weeks, everyone was concerned with milestones. The first patient, even the first death, some things like that, and whether it was the media, whether it was the public, et cetera. That's where a lot of the questions and concerns were. That then kind of evolved to some of the changes we were messaging, especially as healthcare systems. A lot of that was around visitor policies, how that was going to change, and what that meant for them. So we saw a lot of questions from like labor and delivery, people coming in to have babies, right? It's not elective exactly. So at least not in this point in time in the process. Right. And so, they were going to have to come in, and they were concerned about, is my spouse going to be able to join me? Can they go into the operating room? What can they leave and come back? So it was a lot of those types of questions. We've now moved a little bit into this place where, and you see a few screenshots here, where some organizations are doing an amazing job highlighting the heroes and the providers that we're seeing across the country. And so it's a great opportunity. We do this anyway as hospitals and healthcare systems, especially because we have different, monthly observances, weekly observances, daily observances through the years, where we look at doctors, nurses, PTs, OTs, et cetera. This is an interesting opportunity. You see the Michigan Medicine example. They've started a hashtag, Hail to the Front Line, which if you're familiar with Michigan, that would make sense. And then you see, being able to maximize the use of subject matter experts like you see there in front. One thing that we are seeing, which I think this is a great takeaway and a great tip, is that as organizations, and this goes somewhat to internal communications, as organizations, we have a lot of ways that we communicate with our employees, with our stakeholders within the organization. One thing that we've heard and seen is, I don't have time. We're really busy and everything has changed. My world has changed. Just tell me what I need to know. And so we've had different, like healthcare systems, for example, cut down the amount of communications and have one specific communication, which is, here's everything that you need to know, in getting rid of, at least for now, some of the emails and newsletters and things like that they're doing, and just having a COVID-19 specific update from leadership that's coming out. We're also looking at, it's a very similar scenario that you see anyway, but a lot of these organizations, especially as you think about nursing, people are not in front of computers, right? And so how do you disseminate that messaging within the organization is really important, and using those command centers to do that, to go down through shift change handoffs, stand-up meetings, department meetings, et cetera. But ultimately, I think, this is a great example and a great opportunity for us to, message to the community, support the community, and then have these heroes out in front.
Absolutely. And that's a great example, just in terms, and I've seen a lot of great examples. I follow a number of health organizations and them promoting their staff and the great work. It almost boosts confidence in their communities, right? Since there is a high level of trust in local healthcare organizations.
Right.
So just in terms of moving on to the next question, in terms of building long-term trust with patients and employees on public and social channels, how are you guys recommending that healthcare organizations tackle that?
Yeah, I think transparency, and we use that word a lot in healthcare, but I think it really is an opportunity to be upfront and honest of what's going on. And we've seen that in some other non-healthcare world, examples of CEOs that have put out some very compelling messaging and videos to their employees. But I think to build trust, I think number one, we talked a little bit about some of the listing changes that have happened, right? Is to go out there and make sure that we have the ability to update and correct and, have those COVID-19 messages on those platforms. So when people are looking for us, they find the right information. Well, this is even more of an important time for them to understand maybe some locations have temporarily closed, or it's not a testing site. You need to go here, for example, and some things like that. And so we can use our platforms to message those types of things. I think what's interesting to me is we need to have empathy in how we do this, and we need to understand that we're moving into a place now that is going to be our new normal, and there's not going to be the ability to backtrack once we get kind of on the backside of a lot of this. So, are we spending more time on Facebook answering questions than we normally would? I don't know. But if we are, then, guess what? That's going to be the new expectation, right? Mm-hmm. And this is kind of fueled in a way, much like we've talked about telemedicine. This has been a kickstart for a lot of organizations into that world of the telehealth world. Well, just like they're not the opportunity to go back, we aren't either as marketing and communications professionals. And so I think it's important not to lose sight of what's working now and what people want to hear, because on the backside of this, it's still going to be the same thing, right? We still need to highlight, our heroes internally. We still need to be transparent with the community. We still need to be timely with the way that we respond and communicate online. And so I think, again, there will be a time that we're going to start marketing again. We will. We need to tell organizations, or we need to tell our community organizations, as well as, our consumer and physician population, what services, and that it's safe and reliable and those types of things. And so we need to be thinking about how we do that now.
Yeah, that's a great point. And it's interesting just to compare and contrast from healthcare to other industries. As some industries have been pulling back, not posting as much on consumer goods and just being real sensitive about marketing. But I think it's been a real opportunity and needed for those on the front line of delivering care to let them know that they're supported. So it's been awesome to see the great posts that healthcare organizations are making and thanking their nurses and their clinicians and everybody that's there to support the healthcare in these communities. And I think that trend, to your point, definitely, I think we'll see that continue. And then there's been this also almost, from celebrities and other well-known figures that have been used in various messaging. And I think there's a part of that to build up trust. Ray Romano was used in a Northwell video. If you guys haven't seen that, basically we'll get through this together. And so utilizing some of those celebrities and personalities that garner trust and that people have a warm affection towards. I think we'll see more of that in the coming weeks, but even marketing in the future as well. Reed, how should, there's a number of staffing changes that are happening within healthcare organizations. Some are having to furlough certain components in certain areas of their organization. How should they go about communicating these difficult staffing changes?
Yeah, again, I think, we have to be upfront, honest, and as transparent as we can. We don't have a crystal ball, obviously, so it's going to, we can't predict the future. But I think, depending on staffing, it's a reality for a lot of these organizations. We've seen some, obviously, that have been able to weather it, at least to this point, weather it better than others. And so I think, we need to message first internally, right? We don't want employees finding out online, that some big change has happened, whether that's furloughs or not. So I think, we need to start communication internally before it moves externally in times like this. And so I think, we need to share what our short-term and long-term plans are, how we're preparing for it, what the impact is going to be. How does business as usual, for lack of a better term, come back, after COVID-19 subsides. So after we kind of get past this, again, we need to be transparent and clarify, who's impacted, what that does for the services that we can be offering, and how that we can best still care for the community with the dedicated folks that we have. Understand that most communities can find out a lot of information. People can find out a lot of information online. So if you're a nonprofit, obviously 990s are out there, so people know what your leaders make, or the top, the top 10 in the organization, or kind of however that's broken out. And so understand that there's a perception piece to this as well. And you've got to be cognizant of that. And we've seen, again, some pretty incredible leaders across the healthcare industry, donate salary, defer compensations, like that. And so again, these are all things that need to be messaged and understood as best they can, first internally and then externally.
Great advice there. And just from a online presence management, you were encouraging folks. We've seen an uptick in from an employer brand standpoint. So monitoring your Glassdoor and Indeed reviews and being empathetic in your responses and reaching out. We're going to see that continue. And then as we see things come back in the future, I think you're going to see a lot more activity from folks interviewing for various roles as things open back up. And then just, as time goes by, we're going to see those platforms be utilized. And I think all the great work that organizations are doing to serve their communities will obviously impact the employer brand on folks either applying and interviewing in the future, but also for those that were treated well during all of the crisis, the employees that were treated well. I think that's going to have a positive impact as well on organizations' employer brand. So just throwing that in. So beyond COVID, and it doesn't seem, with a lot of talk about maybe there being a second wave, COVID's not the talk about it, and information and the planning and communication, all that stuff's not going to go away anytime soon, at least from what I'm seeing. But what should marketers be planning in the next 30, 60, 90, 120 days from now? What are some initiatives from your perspective they should be looking at?
Yeah, I think, again, I think there's a real opportunity to highlight those heroes within the organization. I don't think that can be overstated, because, they're not all of a sudden heroes, right? They've been there all along. And so I think this is an opportunity for that. I think another interesting piece that we really need to think about is, you mentioned Glassdoor and Indeed. I think just reputation online in general is going to be interesting coming out of this, because we don't know what's happening. Obviously, we've already seen a number of changes with Google to cut everything off, to let some things back on, to start rolling stuff back out. And while, at least from what I'm seeing with clients we're working with, the overall review volume going down, community management's still there, because we're seeing more comments and more questions and concerns come in through these social channels than we historically have. I don't know how that's going to shake out after this, right? Do reviews go back up and people stop commenting on all your social posts and things like that? I do think there's an interesting opportunity with as many people that are involving themselves and integrating and interacting, with your social content. You think, and again, I don't work at Facebook, or don't pretend to work at Facebook or Instagram, but you would think that is going to ultimately help kind of some long tail organic, right? We've got people that, from an algorithm standpoint, now that people are interacting with our content, we've got an opportunity to maximize that. So, being cognizant that we've got people's eyeballs, we need to think about, well, what is it, and that we need to be talking about. And so being, confident in what it is that you're doing as an organization, I think is really important, and what those services and abilities of the organization look like going forward is something to work with that senior leadership team on, to make sure that we understand, when certain electives may come back, and, how do we message safety and quality and things like that in this time.
Great points. And those are a couple of items just to highlight what you said in terms of, as service lines start to come back on. I've already seen some healthcare organizations reaching out to their communities, letting them know, please, if you're having severe symptoms related to a stroke and a cardiac event, please come to the ER. That's what we're here for. So I've seen some communication of ERs already, and I think that's wise because some people may be fearful that they're going to contract COVID, but yet they're having some major symptoms that are that they need to get help for. So, as we see in the now and in the near future, start communicating about those specialties as they start to come online, and with regards, obviously in line with the regulations and what you can and can't do, and that will be an interesting component. But again, what I'm seeing, so many in the community are looking to their local hospitals and health systems to answer those questions, not necessarily from the evening news or from the federal government and other manner. They're looking to the health systems. What are you guys hearing, and keeping us informed? So obviously that's part of most health systems communication plans now. I think that needs to continue. There will be, no doubt, a lot of pent-up demand for elective procedures. And so as organizations change their hours and have alternative hours, I'm hearing this from various folks within health systems that they're looking in the coming months to have Saturday and Sunday office hours where they wouldn't have them before. So making sure that you have a plan to communicate those changes to consumers and patients, very important. There's a question that came in, reads, do you think social media participation will subside once people get back to work and they have less screen time? Or do you think that has a factor in it?
Yeah, I mean, the knee-jerk reaction is, probably, I think so. But again, we've spent all this time acting in a certain way, and, you're building certain habits right now. And so I don't think it'll be a light switch. I think it'll probably taper back off, obviously, as we work our way back in. But just like, the furloughs, the stay-at-home orders, all the stuff that we're seeing right now just in life, the economy, it's not a light switch there, obviously, right? I mean, it's not all of a sudden one day everybody goes, okay, everybody just head on back, do what you were doing, right? It's going to be similar to that, I think, in the social sense. I think, again, because we're going to be tapering, back to life and to normalcy to some degree, we'll see that probably adjust over time, but probably not quite all the way back to where it was. I still think we'll have, a heightened level of activity, at least for a period of time on social.
I would agree. And even with some of the changes that we'll see, with the, there's going to be a lot of questions around billing in the future. There's some services that are subsidized by the government through the CARES Act. And I think there's going to be a big opportunity for marketers to communicate around billing, what's covered, what's not. And those things tend to come 2 or 3 months after, with regards to, and a lot of times they turn to social channels rather than calling. They're asking questions, or at least seeing if their questions have been answered already online. So I think, overall, we'll see a continuation of a lot of activity from a social standpoint, but guesses at this point, don't have a crystal ball. We are at time, a little bit over. We had some other questions that have come in, and we'll respond directly to those if we weren't able to get to them now, because we know we're at time and want to respect everyone. Just from a real quick read, this question coming in, how physicians and staff, and as far as using physicians and posting, what's your take on them right now, your physician, and profiling them in specific posts, video, blogs, etc. How can I convince them to engage is the question.
Yeah, well, I think, so there's the logistical side of just time, right? Like, I mean, do they have time? We do have a fair amount of physicians right now, obviously, that are not as busy. So some of those are folks like in imaging, for example. So do you have some superstars? Do you have some folks that are media trained or that you've used historically that, whether their offices are closed or their particular specialty is just not one, like anesthesia, imaging, et cetera, are those guys that we can tap, right? So I think that's one way to look at it. I think another way to kind of think about this is we do have to be careful because burnout is a real thing. We were already talking about burnout before this even started. So, be cognizant of what we were asking or what we're asking of folks, but, look for some of those individuals that, potentially, would want to do this, are good at it, and, or maybe not as busy as some of the others right now.
Good answer. Just I'll extend this a little bit longer. Those of you who can stay, please stay. A couple of other great questions have come in. We know that the healthcare frontline workers are going to need healing time. Should hospitals be messaging on how they'll manage staff and help that personnel, how they're going to help them? Reed, what's your take on that?
Yeah, absolutely. Again, I mentioned burnout just briefly a second ago. I think, again, we heard about it a lot, especially if you're thinking about physicians. Physician burnout, is a big topic. I think we'll see this. Everybody's seen the pictures that have gone around of folks that have worked, massive hours. And even on top of that, maybe they're working normal shifts, but they're not going home, right? They're in a highly, like maybe they're in the New York or New Jersey market and don't want to, bring that home to family or loved ones. And so, while they're getting their normal time off, so to speak, they're not able to live their lives as they normally would, even more so than the rest of us. And so I think we do need to think about, again, messaging internally first and externally second, how we're going to, handle this. And maybe that means electives don't come back quite as fast, or certain ones, or I think it is something that's going to have to be taken into account for sure.
I agree with you. And I think, those that are investing in programs and around behavioral health for their employees, I think are going to realize a huge benefit. And I think I'm seeing some movement, read some articles about just all of what health systems are doing and the importance of behavioral health. So maybe that's a episode, quote unquote, episode for the next webinar, Reed, just around behavioral health, because we know there's a lot there. All right. Well, thank you everyone for joining. I'll cut this off because we said we would only do this for 30 minutes, but thank you for staying around. This is going to be, it's recorded, so we'll be sending that out to everybody and then providing you some additional resources that might offer some guidance and help and benefit. So we hope you stay safe and healthy. Thank you for joining. Please let us know, both Reed and I, if we can be of any assistance. You can find Reed on Twitter and myself, but then also feel free to reach out to us individually and happy to have any conversation. I'm speaking for you on that, Reed. But
absolutely.
Sure
I would love to connect. Twitter, LinkedIn, email, whatever's easiest. Happy to do it.
All right. Well, thank you, Reed, and thank you all for joining. Have a good day.